And we are back on the inside on this Tuesday, August 31, final Tuesday in the month of August. And yeah, I had enough of August, honestly. Like, literally, really, Kareem, like, seriously? Like, good morning, Kareem.
Hey, dude.
Good morning, Kareem.
Good morning.
Yeah.
All is well?
And now you may proceed with further questions. You have to tell somebody good morning and they answering you how you doing. Like,
I'm asking a question. You do like, how
I'm
did you
doing
sleep
good.
last night?
I slept well, thank you.
What? Okay. It doesn't usually answer that one. So.
Well, if you don't usually do something, sometimes it's good to flip the script and switch it up because you expected me to not answer. So sometimes you gotta do the unexpected. Good
I,
morning, Marian Della. Good morning, Nigel. Oh, you're coming in. We have a really nice topic today. I saw this one online and I was like, yeah, that's the topic for today. Gotta ask this questions today. So come on in, come on in, come on in. Good morning, Christelle. The meantime, before we delve into today's topic, let me see if I make sure my volume down. Yep. Let me just share, and then we'll tell you what we're discussing today. We got a pretty good topic today. As a matter of fact, I kind of had this conversation already with someone who actually had this scenario with a friend, and I saw it online, and I'm like, wow, maybe that's a good topic for discussion because since that is what's happening now,
mm-hmm.
and it seems to be the battle of the vaccinated versus the unvaccinated. How about that for a topic generator? So probably when you guys came on, you would have seen what the topic at the top. But before we get into that, just wanna extend condolences of the family to the family who lost their loved one to, of course, COVID, already having, other health issues and compounded with COVID, lost the battle. And that makes it two death, COVID related death. And praying and hoping and wishing and everything that we wouldn't see more people, succumbing to the virus. Yesterday, we saw the dashboard showing 104 new positive cases, and the total active cases are 267. We have six currently in hospital, and isolation 267. Total persons in quarantine facilities 540. So we continue to fight the good fight. We continue to encourage folks to wear their masks, to sanitize, observe protocol. This morning again, observe more folks wearing their mask. Only saw one young lady sauntering across the pedestrian crossing. Not even there was not even a sign of a mask. Not even under her nose. Not even below or on hanging from her ear. There was no mask, and she was moseying across the the pedestrian crossing yesterday while leaving work. Um, saw a bus driver, and that was so hilarious. Bus driver by former Andal slowed down talking to somebody on the other side of the street. There's a policeman right there, that roundabout thingy.
Mm-hmm. Mm-hmm.
And his mask is hanging under his chin and he's shouting across the street to another man and nothing, but we continue to encourage folks to because no matter what some may say or do, there are some folks who just don't like adhering to protocols or being told what to do or just don't like following directives. Doesn't matter who it comes from, doesn't matter what it says, they are just folks who have a problem following directives. And everything will be either they're lying, and I'm seeing, and of course, making reference again to this morning's presser, still seeing what they're lying. I'm still trying to figure out what do these folks get from coming on national TV and radio and to lie to us about when the information is out there if we really want it. How could they possibly lie to us? But it sort of brings me to this part that I did this morning, which says you're allowed to change your mind. And there's nothing wrong with changing your mind, especially when you learn something new. When you experience something different, you can alter your opinion accordingly. You can change your mind and you can still be you. Even if you're heavily invested in a particular perspective. I mean, there's a lot of value when you can be steadfast in your thinking. Kudos, props, hey, hip hooray. But my thing is, there's no value in being stubborn when quality, credible evidence contradicts your thinking. There are some people who are holding on to that, knowing that they're wrong, knowing that there's quality, credible evidence. Because to me, when any opinion ceases to have a solid basis, doubling down on it is not an effective response. Just open up ourselves to other possibilities, to informed and tested perspectives. Because one thing I've learned is that an important part of being right is admitting when you're wrong, and anyone who refuses to do so cannot maintain credibility.
Mhm.
So, just want to remind us all to get a grip on reality, the here, the now, what we're seeing before us. Sometimes you don't even have to listen to the folks that we claim to be lying. You don't even have to listen to them to grasp a hold of reality. You can be resolute in your perspective while at the same time be willing to change your mind. And nothing wrong with changing your mind. Yeah? But I beg and urge and plead for all of us to get a grip on reality and what is happening. It is before us. All right? Moving along.
Merrily down the stream.
Stream, yeah.
So, guys, this morning we want to know, as we in the middle of this pandemic, here's the question. For the vaccinated folks, would you date an unvaccinated person? That's what we want to know today. So you're vaccinated, you took your 2 shots, you're free to go about your business. See a nice, attractive, unvaccinated person. Where
You
you
don't,
doing?
you don't see them. You have to ask first. You don't see somebody not vaccinated. You don't know if somebody
They have a
vaccinated
look.
or not. No, they
They
don't.
have, they have a
See,
look.
Reginald is making a really good point here. He says, I'm fully vaccinated. That don't mean I can't get or spread the virus. And that is what we have to understand. Being vaccinated does not, absolve you from being responsible. You also have to be responsible. You still have to wear your mask, still have to do the social distancing. You still have to observe, sanitize and wash your hands and what have you. Being vaccinated does not mean you can't get the virus. And we got to keep on pushing that, pushing that, pushing that. It means probably wouldn't end up at the hospital, being extremely sick, and all those things. That's what they say. All right. So the question again, Kareem, is Marlene, we're not starting no drama. This is a legitimate question. As a matter of fact, it is something that actually happened. It is an actual real life situation. Somebody vaccinated and their significant other isn't, and they're not willing to do it. And the person decided to end things with that person as a result.
Lie.
Yeah, as a result of that. And you're going to have more conversations coming up as more people decide to take the vaccine or not to take it. You might be in a home where you decide to, and another person decide, their significant other decide they're not going to. Now that is their right. You can't force that against them, but it's also your right to protect yourself. And if you think vaccination is the way to go, that is on you. Either one can't force the other one to take or not to take. That is a decision you have to make. But if you decide to take it, the question is, would you get into a relationship with somebody who is against it? Or if you're already in one and the person is firmly against it, what does that spell for the duration of that relationship?
I find that one tough. You leave the person.
The person actually left because according to them, you can't claim to love me and you're not thinking of my health.
but no, 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 no,
At
no.
the end of the day, my
Hold on,
thinking
hold
is
on,
not the
hold on, hold
plague,
on,
it's not
hold on, hold on,
leprosy,
hold
it's
on, hold
not
on.
HIV, but there are people who feel very strongly against it.
No, but Aruna, at the end of the day, right? As much as you vaccinated and all of that,
Mhm.
Mama, you could bring home COVID twin. It's not
Yes.
just me. The
Yes.
only difference you have versus me is that I might have to make a trip up on the hill.
Somebody say, hold on, this person says, hold on. Probably not. They can't go anywhere because the way the world is going, you have to walk with your vaccination card. And I don't plan to go over by myself on dates. Can we be serious?
Boy,
It's a serious deal right now.
nah, that one tough.
What say you? I'd love to get y'all feedback. This person says some of them never take an STD test, but making vaccine the hill they die on. That's nonsense. Someone said, it's funny you said that because I actually saw something which says, imagine not dying from, imagine not getting something to do with not wearing a condom or not getting an STD, but imagine dying from shaking your hand, someone's hand unprotected,
Mm-hmm,
but not
mm-hmm.
dying from unprotected sex. Imagine that. For years, we were preaching protected sex, protect yourself, wear condoms, do this, do that. And now you don't even hear those things. All you're hearing about taking precautions against a virus. When was the last time you hear about wear your condom and safe sex? When was the last time you heard that?
Listen to something. All diseases right now are obsolete. It's just COVID.
Hmm.
It's just COVID direct. That is how the world is right now. If your leg break, it's because of COVID.
Chris says, I would. It's not like they have some contagious sexually transmitted disease for which the vaccine is the only cure. It's like having friends who are not vaccinated and dumping them as friends. I won't do that. But would you be around them knowing that they're not without feeling a type of way? Someone says yes, as long as she's using the other safety measures, mask, social distancing in public, and she's healthy. Not so long we were all unvaccinated and all we had was the mask. Why should we discriminate now? Another person says, no matter where you fall on this issue, it says a lot about you if you decide not to or decide to get vaccinated if you are able. I don't think that a relationship between a person who believes in vaccines and a person who doesn't would last long or go well. Why not?
Mm.
Why can't we just respect each other's choices?
Why?
Why, if I believe in something and my partner don't believe in it, that's grounds to go separate ways. I guess you feel very strongly about it. Someone says, yep, I got vaccinated to protect myself. Another person says, I did. We went to lunch one Sunday and he was running a fever, feeling worse by the minute. Took him to urgent care where he tested positive for COVID 19. I helped him for a week since he has no family here, but that was a lesson. In my opinion, he didn't care what kind of burdens he put on the people close to him by not being vaccinated. Wow.
But nah, boy. I find that one tough, man.
Listen,
That one tough.
you realize I ain't even have an opinion. I'm just reading opinions.
No, that one tough.
Someone says, I have been, but he has started the process because work requires it. He wears a mask and has been precautious, so I'm more precautious, so I'm okay with him not being vaccinated. It was his choice.
Because I mean, it's still all about personal opinions and personal feelings and all of that. So essentially, what you're telling the person is my way or the highway, kind of.
Yeah, well, I mean, you do have there's no wrong in this, everybody have a right.
Mm,
You're not wrong for feeling the way you feel because you're
right.
vaccinated, and the person isn't wrong for not being vaccinated.
Mm,
And I think that is where the problem lies. People vaccinated and unvaccinated seeing it as a right and wrong issue. Both parties aren't necessarily wrong
mhm.
because people have a right to feel strongly about what they put in their bodies, and others have a right to protect themselves by whatever means necessary. So it's not like a right and a wrong situation. To me, it's just what can we use? An ethical,
Mm,
moral, personal.
personal.
Yeah, I don't really see it as a right and wrong issue
Mm-hmm.
because who am I to tell you you're wrong for taking a vaccine, or who am I to tell you you're not right?
Yeah.
You're wrong for not taking it. It to me, personal choice. Um, Someone says, I would not date an unvaccinated person. I've got an 11-year-old unvaccinated child and a child with diabetes. Lack of willingness to follow basic public health and safety guidelines is indicative of poor judgment. The exception being someone who can't get the jab due to medical conditions. Folks who get vaccinated are significantly less likely to be extremely sick, much less likely to be hospitalized, and substantially less likely to die. It's about risk reduction, and I'm not living on the wild side. I've got 3 kids to raise.
Mm.
Someone says, yes, I would. In fact, if there's an unvaccinated woman who she called right now, she opened her heart and her leg. We right there.
Don't go there. Don't go there. Right.
Really, 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 Stephen?
Today's just
Really?
Tuesday. Don't go
Wow.
there.
Stephen says, if you open her heart and legs for me, I'll be there. Wow. Listen, can we be serious? This is like serious, serious.
But hold on, wait. Since COVID,
Deirdre says you have to show your PCR test like you have to show your STD and credit score before a relationship start. Some people are afraid just to take a virus test, but not scared to hide and cheat. What you were saying? Hold on, I'm some more here. Let me see what this person on the WhatsApp saying. For his protection, I will not date him because I'm vaccinated. I can get COVID and not know it and pass it to him. So I don't want to put him at risk. So I would choose not to date him. But you can also give it to someone who's vaccinated as well.
that's what I
They're trying.
said.
So
Okay, so here's what I see it. If we run in an establishment or something, and you know the law says get vaccinated or whatever, whatever. So let's say we have a restaurant or a bar or something. You know, this is what we have to do to continue earning our living or whatever. And you still decide not to get vaccinated, then clearly you don't care about our well-being or financial status and all of that kind of thing, you know. But to just say you and I together, you choose to get vaccinated, I don't, and we're gonna break up over that. I mean, both of us could give each other COVID. So, I mean, mother don't like you, father don't like you, all you stay in. This is what.
someone says, never thought about it, but I guess it makes sense that if we fall on different sides of this issue, we probably aren't very compatible.
Hmm. This one look
Someone
interesting.
says here,
This one look interesting.
hold on. This person says, you can read it. Hold on.
Yeah.
I know a woman who didn't get the vaccine and she belittles people who did when she talks about the subject. Even had the nerve to tell me she's better than me because of it when I told her she wasn't. According to her, because I listened to the government and I let them put something in my body and I don't know what it is. Yet she drinks almost daily, not knowing exactly what's going on in her body, and wears a face mask, something the government told us to do. She's nuttier than a squirrel. So to answer the question, I would, but not if she shares the same views as I mentioned. Most of all, don't be a walking contradiction. What you were saying?
Someone says it truly depends on who else is living in your house. For example, if the vaccinated person is putting their personal decision above your family in the house, then time to say goodbye. Why would you put a relationship above a family when they don't respect your relationship enough to care about you and your family? Guess when you put it that way.
Listen, there are people who I can't even find some knock wood or something to knock on. Even though our numbers are rising, right? For the most part, from since the onset and we've started getting cases, folks have been able to recover without, long periods of hospitalization, or we have not seen, the death toll like other countries or islands. So to a lot of people, it's still an out there thing and not here. Now, for folks who had like a front row seat to what COVID did to family or co-workers, especially folks who work in the health field. And I have family who work in the health field. And some of the stories, listen, it is mentally, emotionally, physically, all kind of you can think about draining for a person who is involved, who is in the health field, who works and see people daily dying before their eyes, stretching out a hand saying, help me, right? And you there and you can't do a thing, not a thing. And then you have your family home that you have to go home to. I've heard families say, imagine you having to be a family for somebody you don't even know, a family member for somebody you don't even know because you're not allowed visitors. Nobody can come see you. You're alone. Nobody can come see you. Nobody can visit you. You probably, if you were in a position to talk, get a phone call. But if you're badly off, you now become that family member. And imagine having 6, 7, 8, 9, 10 people like that you have to be that sort of strong support for. Do you know how much of a mental toll that can take on you? That burden that you have to go home to and then pray you don't bring it home to your family. Like I said, we have not witnessed it that. We're thankful, whatever is giving us the ability to bounce back when you get the virus. I can pray that we continue holding on and it continues to work in our favor. But if you have not heard or spoken to folks who are deeply involved in healthcare, I'm seeing when we had the first outbreak out in the States and seeing what you call the thingy, the ice thingy, cooler truck thingy, they had to pack bodies in on the street. Morgues were filled to capacity. You don't even know. There are people who don't even know where their family members are buried. I have not had a funeral. So it might seem like something petty. Some might say it's petty when you're not deeply or directly affected. But for someone who's who's seen it, who's lived it, who's experiencing it, and they probably have a right to feel strongly about it. So that's why I'm saying it's not a right and wrong issue. It's how you feel, what your experiences are in this whole thing. So it can't be okay, you're wrong for taking it or you're not, or you're wrong for not taking it. It can be a right and wrong. It depends on how you feel about it. So if you feel that, hey, I'm vaccinated, I'm dating this person and they're totally against it. I've done everything within my power. I've given them information. I've tried to, help them, everything. And it's like, I feel powerless now because they're just not changing their mind. Nothing I've said or done is helping. Then at some point, we're talking about personal responsibility, right? We've been pushing that, even here in the minister saying that every time. Personal responsibility, personal responsibility. There comes a time when you have to take a step back and think about your personal well-being.
But you see, on the other hand, Aruna, what if, okay, I decide not to get vaccinated,
Mm-hmm.
but in public, I'm wearing my mask, I'm always sanitizing, I'm exercising, I'm eating right, I'm doing all the other things on the other side of it to protect myself and my family. As soon as I get in the house, take off the clothes, put it in the laundry, take a shower thing. You're still gonna leave me for that?
And that's okay for you to do that. That is your choice. That is completely okay for you following all the steps and you're against something. But it's also my choice.
Why?
I know it's
Well,
hard, it's tough,
I,
it's harsh,
I know what to
it sounds
tell.
selfish, it sounds
Yeah,
petty, it sounds all sort of things. But like I said, in the grand scheme of things, when you look at the end result,
I know what to tell the side chicks now. You're not vaccinated, so we have to break it up.
that is your get out of jail card.
Well, there's a new one.
Wow.
There's a new one. How to pick up that? Hey, I never hear that yet.
So
Now vaccinated, the other bunks.
BB says it's a horror movie. I remember putting almost 6 and 7 bodies in body bags every single day I go to work. I cried all the time because it was people I was taking care of. We're not ready for you yet. Hold on. Yeah. So
Yeah, I mean, just this morning, honestly, like I was looking at the numbers, and I'm CNN and stuff like that. It's in the millions right now,
why are
So
you seeing people living their best life out in New York and other places?
the outside.
COVID is still there, but it just so happens that New York is one of the places that are, I think it's 80 something percent of the folks are vaccinated. So they're outside. Doesn't mean that the numbers aren't, up there or rising. But compared to when we had the huge amount of hospitalization. Um, I'm subject to correction. Is that still happening? I'd love if somebody who lives there or probably have information can let us know. Do we have those high intake in terms of hospitalization in the New York area? Ari says, so what happens if the person is medically unable to get vaccinated? Then what? That's a good question. Would you still kick the person to the curb, knowing that they would love to, but they can't?
Hmm.
Would you?
Oh boy.
Someone says before COVID, everyone was living fine, and now COVID got everyone thinking different about each other. AIDS, cancer, all diseases were here before, and no one noticed them, and now everyone has gone smart overnight with COVID. Lord help those who serve you and believe in you. Someone says, just out of curiosity, for the unvaccinated people who say it's your body, your choice, are you the same ones who argue that sentiment for women and their reproductive systems? Okay.
Hmm?
I wasn't quite ready for that. But what say you? Were you also quiet this morning on the subject?
No, that one
Y'all
tough.
afraid to speak on it? And
That one
that's
tough.
I'm glad about. Yesterday I had to talk about this, but I forgot.
Hmm.
Discrimination. People are afraid to speak up or let it be known because they're being discriminated against. COVID is not HIV, it's not AIDS. And people are acting like people who have it, they're like they have the plague, they have leprosy, they have some disease, incurable disease.
Mhm.
Why? If we look at the recovery rate and making specific reference to Grenada, it's higher than the death. So what's to be discriminated against? If you know somebody who is COVID positive in your neighborhood, what have you, nothing's wrong with dropping some fruits on their doorstep or calling, checking. You don't have to go in their home. You don't have to touch them, talk to them. You can stay across the road and talk
Mhm.
or call to ask if they're okay, if they need anything. But shunning these people as if, they have some, incurable disease is not the answer. Now is the time for people to be looking out for each other as best as they can and helping a hand if you can. You don't have to go into the home physically to do that. You could leave something on the doorstep, leave something in the yard. I'm seeing a lot of folks complaining about that.
Mhm.
That is why someone might have the symptoms and not say anything out of that fear. And by doing that, they're not doing us any good. The quicker we know how many people are positive or whatever the case might be, we're in a better position to handle this. But I don't get what is to be discriminated against. If you don't protected sex and getting AIDS and what's the name anything? Claps, chlamydia,
Yeah, but I think it. I
grabelos.
think it.
What,
It
what's the other thing people just get?
syphilis,
Syphilis, hepatitis,
gonorrhea,
A, B, C, D, gonorrhea. What else? What other sexual disease, transmitted diseases there are?
hepatitis A, B,
B,
C,
C,
D. Yeah.
and
Now, but I think it has a lot to do because think about it. If you have like our health officials and so on, when they listen, Aruna, you know how press conferences go here. It's only a bill that's be missing in it. To just take it and just they speak with so much passion and things. So when you look at that so often, it must instill a sort of fear or sort of something in you as a people. So right now, and just speaking to people about COVID and stuff like that on the street and so on, honestly, people are a bit frightened. It's
they
like,
are.
yes, even though two people died, it's still a percentage out of 100. Somebody died. So people are definitely scared. So as we were saying yesterday, and we say so many times inside here, the message still has to be a little bit different. It can't
Listen, and I
just
must
be.
give kudos to them this morning. Those
Mm,
two young doctors they had.
mhm,
Listen, it was relatable. It was everything was just
mhm,
on point.
mhm.
The messaging it was clear. You could I understood. There's some things I was unclear and unsure about. Now I have a better understanding. The way
Right.
they broke it down,
Mhm,
the empathy. They were relatable, and I think we need to see more of those two doctors in other forums.
mhm.
Spreading the word and giving people the information and stuff like that. They did a wonderful job. Even this morning, Mr. Steele, I heard reading a release which says that he had a moment when he heard about the death of that lady yesterday, and I just want to really really commend again those two that we had in that press conference this morning. They really
Mhm,
made it worth listening to. The way they broke it down.
mhm.
Bobby says outside are making the is it outside or outsiders you wanted to say? I think it's outsiders are making decisions based on vaccine levels. Once they hit 70%, then it is open across the board, and the unvaccinated can live or die with their choice. Some countries are heading to even different level where the treatment is at your personal cost, which means insurance coverage, because the state simply cannot handle the costs. This is another thing we have to keep in mind. How long can a government with no money continue to pay to run the healthcare system, to look after those that um, I can see the rest of it. That what? Um, can you see it on your thing? The doesn't allow me to see the end of it. It stopped at that.
So, how long can a government with no monies continue to pay to run the healthcare system, to look after those that refuse to care enough to do anything that could help? Mm,
I say on a serious note, I pay more attention to whether or not people are following the protocol, sanitize, wear your mask, and stop trying to be outside all the time. All ICU bed in Atlanta is full of COVID patients. It's really bad. Oh wow. Someone says our numbers are high in California, but more people are getting vaccinated. Says last Friday, Atlanta recorded their highest infection rates in 7 months, 10,000 in one day.
wow. Jeez.
Uh, wow.
Listen, if you go to follow this news and thing every day and these stats and thing, you get depressive.
So I am taking a break. Anyways, I think that's about all the time we have. Hold on, let me see for a bit of information here. Um, okay, folks, for the folks, KFC and Grandon's branch, they're open for takeout. All right. So ignore anything else you would see regarding that. So KFC Grandons, they're open for the Grandons branch. They're open for takeout. Remember, only takeout services. All right. Anywho, I think that's about all the time we got this morning. I don't think I got a definitive answer as to how people what's gonna be your take on would you date vaccinated people? Would you date an unvaccinated person? I have not seen any substantial yes no. As says, compassion and humanity seem to have been traded for discrimination and division. Yep. So vaccinated against unvaccinated.
Mhm.
That's the battle of that's a battle we're fighting right now. Hold on, let me see if I got anything else here. I think that's about it. Yes, someone says it's okay to not want the vaccine, but the people who refuse to take any precautions is what gets me. Yes, you may live, but the person you spread it to may not. It's just self-centeredness for me. Says no matter where you fall on this issue, it says a lot about you to get if you decide not to or decide to get it if you're able. I don't think that a relationship between the people who believe and those who don't would last for a very long time because it would always be a contentious issue, causing arguments and later leading to frustration, and eventually you'll go your separate ways. Is that bad? Alrighty. Anyway, guys, thank you. Thank you so much for joining us this morning. We'll be back tomorrow with another one. Thank you so much to our friends at Beacon Insurance Western Union and Halibaranj. And of course, just to remind you that KFC Grandon's branch is open for takeout. All right. Catch you guys tomorrow, same time, same place. Thanks so much, everyone, for contributing this morning. Yeah, the live was active. Appreciate that. All right, guys. So stay safe.